Good afternoon, everyone, and welcome to our bi-weekly COVID-19 update. My name is Melanie Jones, and I'm a health educator for the Lake Cumberland District Health Department. And today, joining me, I have Amy Tomlinson, our Executive Director, Dr. Wayman, our Medical Director, Laura Woodrum, our Director of Nursing, and then we have a few more guests today. We have Stephen Eubank, who is the chief of the Somerset-Pulaski County EMS, Dr. Rainer Oliver, the hospitalist for the Lake Cumberland Regional Hospital, and Laura Belcher, the vice president and administrator for the Medical Center Albany. And so our COVID-19 numbers are increasing across the Lake Cumberland area. And so we just wanted to be here to answer questions for you all. And Amy is going to be sharing an overview of the COVID-19 cases across our 10 counties.
Thank you, Melanie. We're going to be brief on the front end of this this afternoon, I guess, so that we can speak with our guests today and hear what they have to say. I'm going to share my screen, hopefully, if this works. Let me see, and show you. I need to be able to share my screen, Chris, on IT. Can you all make that happen for me? Sorry.
There you go. You should be able to do it now. We should be co-hosts now.
Okay. There we go. Okay. Let me find what I need here. Bear with me just for a second. Okay. Well, tell me when you're seeing my screen. Maybe it's having a hard time today. Can you see those numbers, Melanie? Okay.
Yes, I can.
Okay. All right. So we have had a record month nearly for August. The latest daily information is available on our webpage, and I'm not going to go over that specifically. What I want to talk to you about more is the trends that we're seeing. So you can see from the numbers that I'm sharing here, this shows you the cases, the reported number of cases by county across our 10-county region back since March. So in March, we were seeing around 1,000 cases. April went down to 640. It stayed about the same for May. June was our low month where we only saw about 285 cases that entire month. July started picking back up with 1,000 cases. And then for August, you can see we had a almost record. That's almost our new high. We did not get our highest month ever. We missed it by about 50 to 55 cases, I think. But it's basically an all-time high almost. So 5,295 cases reported in August, just in our 10-county area. The number reported March through July, the previous 5 months, was only 3,500. So you can see for the month of August, we far surpassed the total of the previous 5 months combined. So that is a huge number of cases that we're seeing across the district. It was an increase for August over July of 4,279 cases. So that is significant. It is definitely telling us that there is a lot of sickness and illness out here in our counties currently. This chart that you're seeing now is for a summary for the month of August, and it's also by county. It has our total number of reported cases that we gave for each county. So a total of 5,295. How many of those cases in each county were unvaccinated? So the overwhelming majority, 4,740 of the cases that we saw total for the month are or were unvaccinated. That was 90% of the cases that we were seeing during the month of August that had not received a vaccination or had not been fully vaccinated. Also of concern to us is that the number of cases 18 and under are starting to increase. This number for the month of August is actually 28% of our total cases where we're seeing 18 and under. That had been previous months had been in the teens, anywhere from 10 to 15%. We're now approaching, for the month of August, it ended up being 28%. But when we look at that weekly, it's anywhere from 30 to 35% now of cases that we're seeing. So it's fully a third of the cases that we're seeing now are in the under 18 age group. And then this is just a visual picture. This chart is also available on our webpage, and you can filter this to a specific county if you're looking for numbers and trends by the county that we're in. I took all those off and filtered just to the district. So you can see over time how this has played out for us here in the region. As far as COVID numbers go, we were extremely low during the early part of the summer here on the chart. And you can see how this spike has gone exponentially up. We're higher now. This last dot right here, the next to last dot, is the cases as of last Friday. So it's a weekly trend chart. The number here is low for this week because we've only reported 2 days worth of data. So this will most likely continue going upwards when we get the rest of the week's data in. So you can see that the exponential growth is definitely here. We're higher now with active cases and reports of cases than we have ever been across our counties during the entirety of the pandemic. So that's where we're at. That's just a very brief summary. We want to take your questions that have been submitted ahead of time to us and answer those completely. And then we want to get into a discussion with some of our guests. So Melanie, what are the questions we have for today?
The first question is, from the Delta surge in other countries, is there an anticipated timeline for when the US may start seeing numbers from the Delta variant decline?
Okay, so several of the countries have peaked within about a month or two and also declined within that time. However, United Kingdom has had a steep spike up and a steep spike down, but then it's turned and it's spiking again. So I think this is very unpredictable. And it's based on how many people are vaccinated, what kind of lockdown situations we have. I don't think we can predict.
Thank you. And then the next question is, can you explain to me, if a household member is positive, how this could affect my dog or any other animal in the household? While we were positive, our dog was very sick.
So ferrets, dogs, and cats are susceptible to COVID infection, and they definitely can get sick. Luckily, dogs and cats have not been shown to infect humans. So that's a good thing. But yes, protect your dogs, your pets.
Okay, thank you. The next question is, will the health department close my business if I have a breakout of COVID among my employees?
Okay, so there are no restrictions currently in place. You all have probably heard or seen the Supreme Court ruling that came down a week or so ago that basically ended the emergency that was related to the pandemic. And there have been no restrictions in place as far as group gatherings and sizes and things like that. That's been gone for most of the summer. That ended, the last of those, I think, ended with a mask mandate that expired in June. So there are no restrictions currently in place. As a health department director, I have to encourage you to use good wisdom and call it common sense and be wise and educated about the decisions that you're making for yourselves and your family. This is going to come down to, at this point in time, personal responsibility, and we're all going to have to be super vigilant on protecting ourselves and our families and taking the precautions that we feel are necessary. We do not, as a health department, have authority at this point in time to close businesses and things that are related to COVID. We are certainly looking at our usual enforcement activities and things related to that, but we don't have special authorities granted to us at this time to do COVID enforcement. So we are begging the community basically at this point to use good judgment and to take precautions and everything that you have at your own disposal to make good decisions for your family.
We will, however, isolate the cases. So
we do have isolation. Yes, isolation and quarantine orders are still within our power. And that is something that we are actively doing. So when we work positive cases, for sure, we will issue letters of isolation and suggestions and recommendations regarding quarantine for who should be doing that. But that is always a health department. That is not related to COVID. That is something the health department has authority to do regardless of the illness and the outbreaks.
Okay, thank you. The next question is, can you explain to me what the infusion does when a person becomes positive?
So the infusion consists of specific antibodies against the COVID virus, and it should be given as soon as possible to high-risk individuals because it helps you fight the infection.
All right, thank you. And then the last question is, if someone dies and they just got vaccinated within 14 days, do you consider them unvaccinated?
They are considered unvaccinated because the definition of fully vaccinated is having completed the series. If it was a 2-series vaccination, that would be receiving both vaccinations and being 14 days past that to receive their full antibody benefits. So if a person dies before the second dose and the 2-week period to form the antibodies, they would be considered unvaccinated. Was that all of the questions, Melanie? I think we
Yes,
only have a handful.
That was the last one.
Okay. So if you don't mind, I'm going to turn it over to some of our guests and allow them to speak to you all and just tell us their perspective of what they're seeing, because, you know, we all hear and we at a health department also are having conversations daily with our hospitals, with our EMS agencies, with our community partners on the challenges that they're facing and what they're seeing. We know that there's testing shortages. There's issues of finding tests across our 10 counties. There's issues of finding beds for hospitals, you know, that they have patients who need a higher level of care or they need to be sent somewhere and they're having difficulty finding placement for those individuals. EMS, I know, is having challenges with transport issues, and you all may have heard that the governor mentioned last week that we have now a strike team that has been deployed to our region to assist with transports. So as the hospitals identify available beds for people, and they are farther and farther away from our geographic area, that takes our EMS agencies out of our regions longer to do those transports and to get those patients to where they need to be. So those strike teams, I think that's part of the purpose of them. And then maybe I'll just start there with Chief Eubank and ask him to talk about, from an EMS perspective, what you're seeing with your staff, how your transports are going, your numbers, what are you seeing, and how are these strike teams helping the region?
So with COVID last year and the lockdowns, a lot of people stayed in, avoided the hospital, they wasn't traveling. This year's been completely different. We have people that are not following recommendations, so it has increased our run volume. Even pre-COVID, we're looking at a couple hundred more runs per month, and that takes a toll on our staff. And like he was saying about the transfers, as we travel, it's not just a drive to Lexington because we've got the delay at the hospital of transferring the patient and then getting back. So sometimes our crews are out of service for 6-7 hours just getting this transfer completed. If it's a COVID patient, of course, they've got some extra decontamination of their unit before they can be back available. So the strike team coming in, I found out about it Thursday afternoon that it was coming here. There's 3 teams in Kentucky. Each of those consists of 5 ambulances and the crews to operate those. And so there's one here, one in Prestonsburg, and one in Louisville.
Stephen, I'm sorry to interrupt you, but it's hard to hear you. Could you get closer to your microphone just a little bit? I'm sorry.
Yeah, sorry, it's a new camera and mic. I'm trying to get it worked out. So the strike teams, their primary purpose is interfacility transfers. They're not really here to help us with our emergency runs. That wasn't their mission. And we've utilized them throughout the weekend since they've been here. We've I think every day they at least took 1 or 2 transfers for us. And then they've also took some for other counties. Where they came in on a Friday night, it took through the weekend to get a lot of the bugs of the program worked out. Of course, there was the hurricane come in as well. So that pulled some of FEMA's support team away from them. So I think we're starting to get them utilized more. The hospitals have, the KHA was supposed to put out some more information to the hospitals yesterday or today, just to make sure they're being utilized to their max. The plan is they're deployed here for 30 days. And I guess at that time it'll be reevaluated and see where the status of the state and the bed availability is.
So if I understood you correctly, then Chief, if someone has a car wreck, these people, this new strike team is not going to be deployed to treat that or to transfer those patients from the scene to the hospital. They're only doing interfacility, you called it, transfers, correct? So from hospital to hospital or hospital to long-term care, something like that?
Yes, that's correct. And the good thing about that is it frees up the local EMS, whether it's our county or any of the surrounding counties. It frees them up to be available for the car accidents and the cardiac arrest and whatever other emergencies we have in our counties, because we know our counties, we know how to get around in them. And the team that's here in Somerset, it's 10 crew members, and I think they're all from different states. So this is the first time they've worked together, and they all got through together, gave an ambulance, and sent down here to start working.
That's awesome. That's a great resource. That's going to help out a lot, I think, across our 10 counties.
Yes, definitely will.
How are your staff holding up during this time? Just the fatigue. We've all been in the pandemic mode for months and months and months now. Are your staff okay?
They are. They're tired. I would encourage the public to get vaccinated. Utilize your primary care. Had a discussion recently about finding vaccine sites. And testing sites. But when you find those testing sites, find out what their procedures are. If it's something, a lot of these are drive-through, so that you can stay in your vehicle and decrease the spread to other people at these places of business. And then if you find out that you are positive, then follow the recommendations of your healthcare provider and the health department. Stay home, avoid people. Look for resources where you don't have to get out and interact and spread this disease throughout our counties.
Thank you, Chief. Let's go now to some of our hospital partners. We have Dr. Oliver, I believe it was, from Lake Cumberland Regional Hospital. He's a hospitalist there, and he's treating COVID patients, I assume, and you've seen the numbers there at the hospital. You understand what's going on. So can you give us, from Lake Cumberland Regional's perspective, what you're seeing and how your staff are holding up, and just a little info?
Hello, thank you for having me on. I want to thank Mr. Eubank for everything they do. I know that it's certainly been a stressful time for everybody, and I know EMS and all of those crews, we greatly appreciate what you all are doing right now. We've seen an influx, just as that graph has shown. We've been caring for patients here from day one with COVID. The last week or so has been a stretch on our hospital resources. Just some numbers right now, we have 25 patients hospitalized with COVID. That's about 17% of our inpatient census right now. Those numbers don't include the patients we have in the ER, who the ER is helping take care of. And then we as the hospital team are often involved in their care as well. I think probably the most striking statistic that we continue to see is that of these patients that are getting hospitalized with severe disease, nearly 90% are unvaccinated. So myself, my colleagues, the team members, we can just encourage people to get vaccinated. Just like Mr. Eubank said, just continue to utilize resources like the drive-through testing centers. Continue to, if you have some mild symptoms or have a significant COVID exposure, get tested and try to limit your community exposure. We've continued to enforce masking policies to help reduce the spread here in the hospital. We continue to wear these on a regular basis, eye protection, everything we can to reduce our risk of exposure. And we just ask the community to continue to try to encourage vaccination. As right now we're just seeing an overwhelming amount of our patients are unvaccinated.
Thank you, Dr. Oliver. Your staff are most appreciated. We certainly appreciate everything you're doing for our communities, and want to thank you all personally, as well as Chief Eubank. Don't let me forget EMS. They're awesome partners with us. Let me go to Laura Belcher with the Med Center Albany and get her perspective on things there. That's it's a corporate hospital. It's a chain. It's part of the Med Center Bowling Green, and it's a system. However, it's in one of our more rural counties, Clinton County, Albany. They have some unique challenges in settings and things down there too. So let me talk to Ms. Belcher and get your perspective on things as well, if you don't mind. Can you unmute for me, Laura?
Sure. Thank you, Amy. Like you said, we are one of the more rural areas of the Lake Cumberland District Health Department. We have been dealing with COVID with like everybody else since last March. We knew the end to this was vaccines, and so we pushed and pushed until we received a regional vaccination site here in Albany. We, had an influx of folks to get vaccinated in the beginning, and now, we are doing those on a much reduced basis. We are also seeing right now, since we've been tracking our admissions for COVID patients that are fully vaccinated, and we've been doing that since April, because that's really when most of the public were able to have full access to vaccines. We've seen about 8% of our admissions with COVID are fully vaccinated. I know I talked to one of our emergency department physicians yesterday, and a patient told him, the vaccine doesn't work. And he said, do you know how many patients I've intubated here that have been vaccinated? And he said, I haven't intubated any. He said, but I've intubated, 40, 50 that were not vaccinated. We are keeping as many COVID patients here as we possibly can, because we realize Lake Cumberland and our larger facilities are overwhelmed with ICU patients. And so we are trying to maintain as many of those as we can. Some get discharged home, but a lot of them get transferred to higher level of care when their disease or when the virus begins to wreak more havoc on their system. Masking and vaccinations right now are what's going to get us through this. Masks are a short-term solution. Vaccinations, the long-term solution. We at MedCenter Health have required that our employees receive vaccination in order to work beyond today. Today is the deadline for our system at midnight tonight. The expectation is that our staff is vaccinated. We feel that it's very important that we can have our employees come into a safe environment and care for our patients, and that we feel it's very important that our patients are in an environment where we're not going to risk passing COVID along to them. So, I urge you, get your friends, get your family vaccinated, get your children that are back in school right now where they need to be. If they're of age, get them vaccinated. If they're not of age, surround them by people that are vaccinated to try to protect them.
Thank you, Laura. I know there will probably be people who will be like, say things like this is doom and gloom, or this is trying to scare people into compliance and things like that. I hear those things from our community members. I know that's being said and that's out there. And I don't have these conversations. I'm not doing this for publicity or for any sort of scare tactic approach. I want this to be an honest, real conversation with what is being done and what is being seen in our communities. I want you all to understand that this is actually happening. We hear the numbers on the news. We hear them at the state level. We see them in other places. We see them across the nation on national news, but this is happening here in our counties. And these are people that we know and we love and we work with and we go to school with, that are in the hospitals and that are, having these issues and these problems. And the vaccination, as it's been mentioned, is our long-term solution. This is what we need to be looking at as a possibility of how we're going to get out of this. Masking when you're indoors in large gatherings and places where you're not with your immediate family or household members are certainly things that we recommend. Just take every possible precaution that you can. Social distance, hand washing, hand hygiene, all the things that have been said for months now that everyone knows. It's not new information. It's been out there for so long now that I think we're all getting just basically tired of hearing it is what I'm afraid is that, it's in one ear and out the other now. And I want you all to understand that this is still happening. This is still happening here in our counties, and it's not gone away. It's more than numbers. A lot of times I report the numbers and I report the charts and the data and all that, but this is actually faces of people in our communities and people that are in our households and in our workplaces and churches and everywhere. So I want you all to hear that firsthand from each of these partners, the things that they're dealing with. And I encourage you, last week, Governor Beshear put out that it was Healthcare Hero Appreciation Week. I appreciate these fine first responders and first receivers and the people that are treating these COVID the people across our communities and show them some love and some appreciation, some support. They are definitely having a hard time right now with some of this. So I don't want to belabor the point. I thank you all for your time today to join us and to speak. I'll give you one more opportunity. Chief Eubank or Ms. Belcher or let's see, I think Dr. Oliver may have gotten called away, but if any of you all have any further things to say or last final comments, certainly go ahead and make those. And I'm going to share one more piece of information from the health department's perspective before you close for us, Melanie. Any final comments from anyone?
I just wanted to mention that, get your vaccine, wear your mask in public. But if you do happen to contract COVID, there are monoclonal treatments out there for individuals that are in those high risk categories. I know those are available through multiple different avenues within the region. Please ask your physician about those. We do administer those infusions here in Albany, and we have been doing lots of them every day. So, those are to keep people from progressing even further into the virus as far as their health is concerned. So I do encourage you, if you are in that high risk category, ask your doctor about the monoclonal treatments that may be available to you and get tested.
That's a good point. And I was going to say, we're certainly not discouraging people from going to the hospitals. If they need care, if they have a medical emergency, that's where they need to be. However, if it's a non-emergent situation or if you need testing, I know that your hospital there in Albany is doing testing at certain hours on certain days, but if it's outside those hours, the hospital is not the place to be just to go to look for a COVID test outside of your situation there in Albany, Laura. What are your hours as you do testing in Albany?
We are doing testing 10 to 2 every day, 7 days a week. And I know that's a limited time frame, but I think people typically know if they've been exposed or having those symptoms and need to make that a priority. They pull up in one of our spots, they call the phone number, and our staff comes out and will collect that for you. That is a send-off test that ranges anywhere from 24 to 48 hours until the results are back. It all depends on the time of day as well as the day of the week, and also how busy the lab is with specimens from throughout the Commonwealth. But if you have been exposed, even if you're vaccinated and you've been exposed, they still recommend a test at day 5, just to be clear. So we do offer those 10 to 2 every day. A lot of the pharmacies in the area also offer testing, but I do encourage people to get tested if they do have a concern.
So it's a unique situation to the Med Center Albany. Lake Cumberland Regional, Mandy, are you all doing any testing there on certain days or anything like that, or are you just referring outside to providers?
Hi, Amy. So sorry, Dr. Oliver had to step out, so I jumped in for him. We do not have scheduled testing here at the hospital, but we do have some testing available at our Lake Cumberland Medical Associates walk-in clinic, which is right behind the hospital. And I would just reiterate what you said before, that, we would never want to encourage people not to come to the ER or not to call 911 if they're experiencing an emergency. But if they are experiencing something that is non-life threatening, we would say, please contact your primary care doctor or visit one of the urgent cares or walk-in clinics so that we can free up our ER staff to take care of people that are facing true emergencies.
Thank you, Mandy. Appreciate that. Stephen, do you have any final comments from you guys?
Well, you mentioned about thanking the healthcare heroes and supporting them. One of the biggest things you can do is help stop the spread of this virus, whether it's vaccine, mask, hand washing, avoiding crowds. Get tested if you think you're sick. Don't take a chance on it to find out 2 or 3 days later that it was COVID and you spread it to numerous people that could have been prevented if you would have known. So that's one of the biggest things that we would appreciate that. Our crews are tired. We see how tired the nurses and doctors are at the hospitals. And we know everybody is working really hard to get this over.
Thank you, Stephen. Dr. Oliver, you've rejoined. Is there any final comments you have? I think Mandy spoke for you. Exclude you though.
I would just encourage everybody to seek appropriate resources for good guidance on vaccination. Also, if you've had a high-risk exposure or have come in contact with somebody known to be positive, don't delay in following the guidelines for getting tested and isolating. it can take several days before you start experiencing symptoms. Just try your best to eliminate, unnecessary contact. Utilize the drive-through testing centers throughout the county. Try to avoid going into the drugstores to get tested when we have these drive-through testing centers. But if you feel the need, if you feel shortness of breath, or you feel that you're getting sick or in any danger whatsoever, don't hesitate. We're here to help and to serve the community as best we can. Everybody's tired, but we're ready. The hospital's ready to continue to help as best we can. So
Thank you very much.
appreciate you all having me on here.
Thank you for joining us. Melanie, before I give it back to you, let me share my screen one more time and show you this resource that is now on our webpage. Let me backtrack. Hopefully you all are seeing our webpage. This is now the first banner that you'll see when you'll open up our webpage. It says, have you tested positive for COVID-19 or been exposed to someone? And so when you click that banner, it will bring up all the latest guidance on here for you, the guidance documents. So what you should be doing. And very clearly here at the top, we tell you that we are sometimes several days behind, 3 to 4 days typically behind on working positive cases from when we get the reports. It's just the volume is so much for our staff that by the time they get through the end of the day, they've not made it through the day's positive cases. So they're carrying over multiple days now. So we may not be contacting you for a day or 2 or 3 or 4 before you hear from us at the health department. So we want you to have the information right here at your fingertips so you can go ahead and take the necessary precautions. So it clearly says, do not wait on a call from the health department. Find your situation here on this chart and just follow the guidance. If you've tested positive, you can click on this banner and it will tell you exactly what you need to do. If you've had an exposure, you're not fully vaccinated, but you were exposed, what you need to do. If you are fully vaccinated and you've been exposed, what do you need to do? And then just some quick reference there for positive individuals. But that is something that is right there on our webpage that we want to make sure is available, because we don't want people waiting for us to call. Don't wait for a health department personnel to call you. This information is out here. It's available. Everyone should know what they need to be doing at this point in helping us out and taking these precautions. And we are truly working as hard as we can and as fast as we can to get through all these positive cases. We are still contact tracing. We have not given up completely. Even in the surge of all this, we are still doing our very best to get through the cases, and especially those that are in high risk settings, congregate care settings or long-term cares or schools or whatever. Those are cases that we give priority to, and we try to work through those just as quickly as possible. So just make sure that you have the information right here on our webpage to take care of you and your families. Go ahead, Miss Melanie, back to you.
All right, thank you so much. And I want to thank everyone, all of our guests who joined us today. And for all of those watching, we just want to remind you that we highly encourage everyone to get vaccinated. The vaccine is safe and effective. And we want to encourage people to wear a mask, social distance, use good hand hygiene, and to stay home if you're sick. Our next media update will be on September the 15th at 2:00 Eastern Time. If you have a question that you would like for one of our members to answer, you can send those in to our website, lcdhd.org. And so we also have daily updates that we put on our website as well, Monday through Friday. And so thank you all so much again for joining us. And have a good day and stay safe.